Hello, I'm Michael Cordell, president of Medivision. Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. Estimates vary, but experts suggest that more than 5 million Americans may have Alzheimer's. It is currently ranked as the 6th leading cause of death in the United States, but new studies suggest that the disorder may rank 3rd as cause of death for older people, just behind heart disease and cancer, with growth of the older population in developed nations. The prevalence of Alzheimer's and other dementias is expected to triple over the next 50 years. In this video, we review recent progress in the understanding of Alzheimer's disease, as well as ongoing research into diagnosis and treatment of this progressive neurodegenerative disease.
Dementia is an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills that are severe enough to reduce a person's ability to perform everyday activities. Dementia is often incorrectly referred to as senility or senile dementia, which reflects a widespread but incorrect belief that serious mental decline is a normal part of aging. The most common type of dementia is Alzheimer's disease, accounting for an estimated 60 to 80% of cases. Alzheimer's disease is a form of brain degeneration in which abnormal particles called neurofibrillary tangles and neuritic plaques form in the brain and destroy healthy neurons or brain cells. This results in an irreversible degeneration of the brain that causes disruptions in memory, cognition, personality, and other functions. Alzheimer's disease is the 6th leading cause of death across all ages in the United States. For those 65 and older, it is the 5th leading cause of death. Every 67 seconds, someone in America develops Alzheimer's, and it is estimated that nearly 500,000 new cases of Alzheimer's disease will be diagnosed this year. Almost 2/3 of Americans with Alzheimer's are women, although there are more non-Hispanic whites living with Alzheimer's and other dementias than people of any other racial or ethnic group in the United States. Older African Americans and Hispanics are more likely than older whites to have Alzheimer's disease and other dementias. Nearly everyone with Alzheimer's disease has the same symptoms, which include memory loss, confusion, trouble with once familiar tasks, and difficulties in decision-making. The two main categories of Alzheimer's disease are familial and sporadic. Familial Alzheimer's disease refers to a rare genetic form of the disease that is transmitted from one generation to the next. As many as half of the members in the affected family line develop Alzheimer's disease. Amyloid deposition is a hallmark pathologic process of Alzheimer's disease and may be the earliest biomarker, perhaps predicting clinical disease onset by as long as a decade. The premise behind amyloid imaging is that it will permit earlier detection and intervention. This test uses PET scanning with an injection of trace amounts of small molecules that bind to fibrillary beta amyloid. APOE4 is the first risk gene identified and remains the gene with the strongest impact on risk. APOE4 is one of 3 common forms of the APOE gene. The others are APOE2 and APOE3. Studies performed in the 1980s demonstrated significant impairment of the cholinergic markers in Alzheimer's patients, leading to the proposal that degeneration of cholinergic neurons in the basal forebrain and the associated loss of cholinergic neurotransmission in the cerebral cortex and other areas contributed significantly to the deterioration of cognitive function. Further studies on the cholinergic system and Alzheimer's demonstrated acetylcholine plays a role in learning and memory. Current research has cast the amyloid hypothesis into a highly controversial light. It is now generally accepted that a simple linear pathway from amyloid beta to Alzheimer's disease is unlikely, and amyloid beta alone is not sufficient to cause Alzheimer's. There's a large number of other associated pathologies that contribute to disease progression. The accumulation of clinical trials that have tested anti-amyloid beta therapy is adding momentum to the counter-argument, and the consideration of preclinical Alzheimer's and pre-plaque accumulation of A-beta is adding complexity to amyloid hypotheses.